Codes of Ethics. Introduction. It is important for the organization to establish codes of ethics to help build and maintain a culture of integrity and outline the organization's core values and expected behavior in the workplace. It creates a safe, secure, and healthy work atmosphere in which people are respected and valued. Code of ethics is also important because it helps employees make decisions that are in line with the company's values in the absence of a clear rule or direct supervision. This code of ethics is intended to ensure that Three Mountains Regional Hospital performs all fundamental values and practices expressed by the American Medical Association. Every employee is held accountable to terms of code of ethics. All individuals under this policy have a responsibility of reporting the violations of code of ethics. The organization needs to have in place procedures for reporting illegal and unethical actions in a safe manner. Even though code of ethics can improve decision making, it cannot address every situation. Therefore, we encourage the employees to seek additional advice or consultation in instances where the guidance of the Code of Ethics may not be definitive. Patient relations. Patient-centered care, quality, respect, and safety are the priority in everything done at Three Mountains Regional Hospital. The differences of the patients and families should be valued, respected, especially for those who seek care and those who provide that care. Three Mountains Regional Hospital will respect the dignity and the rights of all the patients that we serve. We will act in a respectful manner toward each patient, regardless of age, gender, race, nationality, religion, ethnicity, socioeconomic status, sexual orientation, health conditions, or disability. The main focus is the well-being, dignity, and comfort of our patients. Physician activities. Physicians shall be trustworthy and compassionate in addressing the rights and needs of the patients. Physicians will seek to develop collaborative relationships with other providers to achieve the highest quality of care for the patients. Physicians will refrain from providing treatments to patients if they are unable to safely and effectively do so, or if it's not within their scope of practice. Physicians should seek professional assistance for any issues that may impair their ability to practice safely and effectively. Confidentiality and privacy. Patient's medical condition, medication, family illness, and history is only collected to facilitate provision of best care to the patient. We observe confidentiality of all patients' information. Therefore, we do not share information about a patient without prior consent. However, disclosure is permitted to law enforcement, family members of the patient, or other persons when it is believed that the patient presents a serious and imminent threat to self or others, or as otherwise required by law. We respect each patient's right to privacy and abide by all relevant laws and regulations relating to confidentiality of personal information. Employees should at all times safeguard and protect the confidentiality of all medical records and communication with the patients. Some ways to protect patient information are protecting computer screens, not sharing passwords, and not texting patient information, among many. Communication. Conflict of interest. We should openly acknowledge any potential conflict of interest. It may occur if any outside activities affect performance at the workplace or cause use of hospital resources for other purposes. We do this so that, together, we may make an informed decision about proceeding and to prevent misunderstandings that could detract from the success or credibility of the patient or ourselves. We should refrain from using our position to secure unfair privilege, gains, or benefits. Examples of potential conflict situations are having businesses relationship with suppliers, having financial interest in a firm that is a vendor of Three Mountains Hospital, giving gift and entertainment which can be seen as an attempt to influence a situation. Purchasing or leasing real estate that has possibility of increasing value because of the hospital has interest in it. We protect patients against discrimination. All patients will receive care which is medically necessary without looking upon race, sex, religion, disability, age, marital status, ability to pay, and the source of pay. Patients should have access to emergency services regardless of the ability to pay. We are committed to assisting clients of all cultural and ethnic backgrounds. We should be mindful of the cultural context of clients, respecting their individual perspective, and employing effective cross-cultural communication techniques. We believe that equal access to proper health care and treatment is the right of each individual. Professional development. We will seek opportunities to improve our knowledge and treatment skills to better care for the patients. We will remain current in the field of healthcare through continuous training and ongoing personal development. Transparency and trust. We promote fair relationships amongst the patients and employees and ensure that all patients have an opportunity to examine and share their thoughts and feelings regarding its own care. There should be continuous improvement in quality, services, and cost effectiveness. We should work in ways that honor the wholeness and self-expression of others, designing sessions that respect different styles of interaction to promote political activities. Political participation of Three Mountains Regional Hospital is limited by law. For any reason, the resources or funds for the hospital are not used to fund political campaigns or pay any political party. Hospital employees can participate in political process as private citizens. Billing for services. We bill patients and third-party payers accurately and fairly. Physicians should not offer referrals to other healthcare providers for financial interest. Physicians providing fee-for-service assistance are obligated to. Conclusion. Ethics can form an important part of the identity and culture of a business or profession, such as healthcare. Code of ethics are intended to govern the conduct of members of a given profession, such as medicine. Due to the continuous innovation in medical science and technology, in changes in the medical profession and laws, physicians have developed and updated modern codes of ethics that serve as a guide for the healthcare professionals. by establishing a sound code of ethics. An organization sends a clear message as to the action expected from its employees. The American Medical Association has taken a leadership role in setting standards for the ethical behaviors of physicians in the United States.